Increasing demand combined with less funding is creating a number of challenges for the NHS, and as a result, the use of digital innovations has surged. The Access Group and North East London NHS Foundation Trust are developing new integrated approaches to healthcare, including a virtual ward programme which aims to deliver better outcomes for patients, clinicians and communities.
Mangalaram manages respiratory virtual wards at North East London NHS Foundation Trust, overseeing team operations for virtual patient care.
Hello, it's Lorraine, one of the nurses from the virtual ward.
Clinicians like Mangalaram and nurses monitor virtual patients remotely using innovative technology like the Whizan Blue Box.
When we admit a patient, so we do a face-to-face visit, mainly to set up this Whizan Blue Box. So this is our remote monitoring device. Once it's all done, immediately it will come to our system, where it will alert what's their news score is. So it's a kind of a real-time one. As soon as they have finished it, it comes into our system, it gets displayed on our patient flow.
And they get allocated a bed and...
Yes, based on this news score, immediately it will tell us, okay, who needs a priority.
Virtual patients receive essential tools, including blood pressure monitors and pulsometers in the Whizan box for use at home.
We have this a patient flow manager, and all of these values will come here straight away. And that really helps us to take the decision immediately and then respond to the patients. It's not like a standalone service that we are carrying for this patient. We work together with the secondary care, primary care, and then the community services.
Umesh Gadvi has been working closely with the Access Group to implement an innovative virtual ward solution integrated with the Trust's existing electronic patient record, also known as an EPR.
What the EPR system, or the electronic patient record system, provides, it provides three sort of functionalities. It provides a referral management system, then it provides treatment functionality. So when a patient is then accepted via obviously a referral that's come through, whether it's from our acute partners or primary care partners or social care partners, it allows us to then input that information in. And then the final functionality is the discharge. Patients feel empowered. Patients have the ability to see their information and record their information. From a clinical perspective, our staff are able to see real-time information. Previously, they would have to make phone calls. Now that information is visible from the data. And clearly, from that perspective, we can help the patient recover quickly.
Early warning scores help clinicians detect patient deterioration, enabling timely intervention and possibly preventing hospital admission.
My mum is elderly, right? And she goes back and forward into the hospital, and she loves her home. Like I said, she's not young, so whenever I speak to her, she loves the fact that if people were able to come to her house and support her through that, rather than her having to travel to A&E. She can't walk properly. She struggles from different long-term conditions. So me personally, this type of support, it changes the way my mum can be looked after.
With a surge in demand for NHS services and challenges stemming from funding constraints, virtual care has many benefits.
First of all, we can get the patients out of the beds quicker. So that's the primary objective of doing this. But we get them out of the bed quicker, but we still provide the information back to those clinicians under their care in the same way they look at their patients that they're in the physical beds. And that's really important because clinicians have repeatedly said we don't want to look in two different systems.
Steve believes interoperability is essential for ensuring ease of use for both patients and clinicians in this process.
So it's really important that we make all of these things work together and have as little data entry as possible and automate as much as we can.
The demand for integrated virtual wards is urgent, and the Access Group and NELFT are shaping the future of virtual care.